So my name is Dr. Robin Harlow and I am a GP and Clinical Director in Southern Health. The Willow group came together in 2017 and it was a response to the challenge in particular around recruitment and ensuring that we had a resilient primary care that we could deliver and continue to deliver for our population in Gosport. At that time there was a National Vanguard programme and that was about establishing relationships between primary care and in part and secondary care and community services. There were a number of different projects that were happening nationally, but that one was the one that was the catalyst, along with the conversation in Gosport around same-day access service between the different practices. And that really was for me, and the excitement for me coming to join at that point in 2017 when this was coming together, was about understanding how we could deliver primary care in a different way to how we were traditionally doing it. Ensuring that patients were able to see the right person at the right time. That's a big philosophy of ours. So the idea was to try and bring all that together and bring that expertise together. We recognise that in Gosport there are significant challenges, and we did a recent presentation because we've just gone through one final merger. So we had 4 practices that originally came together, and then we've had a 5th that just joined us in April. There is demand in itself because we are in an area where there are higher health needs, there's more social deprivation here, but also with the challenges of staff recruitment, and particularly around GP recruitment and nursing recruitment. But again, that's what's so exciting here, is about the ability to bring in all these other services to help support that and all these other different roles and their skills. We have the same day access service that was established initially to manage all our same day demand, and that is through a multidisciplinary team approach, so again building on other roles within there. So yes, GPs are within that, but they are supporting the lead nurses and nurse practitioners that are in there, as well as paramedics that create that team. And then building on that, we then had the home visiting service, and again a nurse-led service. We've got very experienced nurses that have worked, and advanced nurses and practitioners that have worked across both primary care and community services, and bring that knowledge and expertise to that team.
Hi, my name's Kerry Hargrave and I'm a nurse practitioner in the Willow group. I'm also clinical manager for the nursing team. I currently I'm working in clinic, which is connected with the same day access team, and what I'm doing is fielding and triaging any responses that come in from patients, and allocating them where they need to go, so whether it's for the same day or whether it's a routine appointment that they need. The patients like the same day access service so much is because they know they get a response quite quickly. It has reduced our the number of patients that go to A&E and use the 111 service, because they know they're going to get a response on the day if they warrant that.
I'm Claire Wood and I'm a community matron. I've worked for the Willow Group about 6 years and I currently do 3 jobs really. My main role is I'm the lead nurse for the acute home visiting service. If anybody needs a home visit because they're unwell on the day, we go out and do that initial assessment on behalf of the GP. I'm also developing the frailty team, so we've now got OTs, physios and paramedics working with us for frailty. And my other job, which is this afternoon, I run an outreach centre for homeless people down at Two Saints. So people that find it really difficult to access primary care because of their lifestyles and choices and things. We deal with anything from mental health, substance abuse, wounds, anything like that really.
So my name's Dan, I'm one of the physiotherapists working for the Willow Group. So I'm here in clinic and ESTAS a lot of the time, or the same day access service. Our job really is to look after the bulk of musculoskeletal patients that come through our service. The idea is to put the specialist at the front of the pathway so we can get it right first time and make sure patients go where they need to go. So quite commonly patients hear the word physio and they think they're coming in for physiotherapy, but actually they're coming in for a musculoskeletal assessment essentially. And quite commonly we'll just give the correct advice and kind of get people to self-manage if we can, but we can also refer them onwards if we need to.
So my name is Jacqueline, I'm one of the advanced care practitioners at the Willow Group. So my main role as an advanced care practitioner is I do triage, so they come in from clinic in the morning and we triage and see what we need to bring for the day or treat over the phone. And that can be for adults and children, can be acute, so happening within the last few weeks, or chronic, that they need review or they need advice or they need referring on to somewhere else or another speciality, including hospital or someone within, you know, the actual GP surgery itself.
I think the patients have been on a journey with us, I would say, over the last 5 years, and again, it's a journey that it brings its benefits and all the wealth of experience and knowledge and expertise that we're able to provide, and I think for patient care that is brilliant.
I'm Marilyn Mullen, currently the Vice Chair of the Willow Patient Participation Group. It's amazing, in 55 years it has changed beyond recognition, from going to Broome where you had your family doctor who knew you and you always saw him, to the situation we have now. We all know it isn't perfect, we all know there's a lot of work to be done, but we are kept well informed. Emma, the operations manager, will give us lots of data, a number of referrals they've handled through a clinic, and then that gives us the ability to question. And I think that's the most important thing really, is that they listen to us. I think one of the things we have learned is that you don't always need to see a GP, and that's quite hard to get across to people, that there are so many people who've got expertise actually sometimes beyond the GP. They'd be the first to admit that if you see this person, they know more about what you want to know than we do, and I think that is gradually filtering through to people, that you know that we can be advised of the best person to talk to, not necessarily the GP.